Federally qualified health centers, or community health centers, are community-based organizations that deliver comprehensive, culturally competent primary health care to all. Our patients include the nation's most vulnerable populations, including people experiencing homelessness, residents of public housing, pregnant women, LGBTQIA+ communities, and veterans. Community health centers provide integrated medical, dental, behavioral health, pharmacy, and vision services in areas with the greatest economic, geographic, or cultural barriers to affordable health care. Rooted in the civil rights movement, community health centers serve as a vital safety net for nearly 30 million patients, with over 1,400 locations nationwide. Community health centers provide high-quality, affordable, patient-centered care to anyone, regardless of their insurance status or ability to pay. 1 in 12 people in the United States get their care at a community health center. Community health centers were born out of the simple belief that a healthcare system should be responsive to the unique needs of the community. Going beyond the traditional 4 walls of medicine, community health centers have long been a leading model in healthcare, innovating care through telehealth, school-based health centers, and mobile units. Community health centers are committed to providing comprehensive care, enhancing health equity, and addressing the social drivers of health. They employ enabling staff to provide services such as patient transportation, on-site interpretation, nutrition education, and enrollment staff to break down barriers to care that often keep people from seeking needed treatment. In early 2020, as the impact of COVID-19 hit, community health centers quickly adapted to national, state, and local response efforts. Drive-through testing, the expansion of telehealth services, on-site vaccine clinics, and triaging COVID-positive patients became the new normal. Health centers continue to serve on the front lines of the public health emergency, rapidly adjusting how care is provided and addressing the unique needs of their patients to ensure their safety and well-being. Community health centers are an important part of the healthcare system in Nebraska. Funding for Nebraska's first community health center was awarded in 1983. Since that time, Nebraska's 7 community health centers have expanded to over 70 service locations, serving nearly 108,000 patients. Of these patients, roughly 45% are uninsured, 68% identify as an ethnic or racial minority, and 95% are low income. Center Association of Nebraska, or HCAN, is Nebraska's nonprofit primary care association. HCAN's mission is to advance the health center movement by expanding and enhancing access, health, and well-being for all. Systemic, structural, and institutional racism and discrimination create inequitable health outcomes for communities of color and other historically marginalized groups. Advancing racial equity and social justice is foundational to our work. HCAN serves as a strategic advisor to Nebraska's health centers, providing innovative, results-oriented training, advocacy, and individualized technical assistance. Our team fosters key collaborative partnerships at the local, state, and national level to educate current and future partners on the mission and impact of Nebraska's health centers. To learn more about a community health center near you, visit hcanebraska.org.